Hello, Representative Kennedy. My name is Sarah Saunders-Harbaugh, and I'm a registered nurse in the emergency department in Chula Vista, California. Nice to meet you.
Pleased to meet you, Sarah. How can I help you today? I love meeting with nurses.
I know how much you care about the health of our nation's children based on your strong published support for social justice. I'm here to tell you about and encourage you to rethink your anti-vaccination stance. I recently wrote you a letter about this topic. Did you receive it?
First, my time is very valuable. And second, I am sure that you will not be able to change my mind. President Trump recently called me and we agree on this matter. I am fairly certain I read your letter, but please give me a recap. Also, thank you for recognizing my passion on social justice.
You're welcome. Well, I respectfully acknowledge your stance, but also choose to reach out to you because I disagree with you. I also believe that your stance is potentially harmful to our communities.
Oh, wow. So you came to my office to change my mind?
I did. Respectfully, I would like to share some information from the top health organizations on the topic of childhood vaccines.
So you don't believe vaccines are causing our nation's children to become autistic? This should be interesting.
I definitely do not see any evidence showing a correlation between the awful disease and vaccines. Let me focus on statistical proven facts. According to the American Academy of Pediatrics, vaccines prevent life-threatening diseases, including forms of cancer. Vaccines have been a part of the fabric of our society for decades and are the most significant medical innovation of our time. Vaccines are safe, vaccines are effective, vaccines save lives. This message from the American Academy of Pediatrics is clear representation of one of the most reliable children's medical institutions of our time.
Okay, well that's one of those organizations with those thoughts.
Along with the AAP, the Centers for Disease Control and Prevention, or the CDC, the American Medical Association and American Nurses Association have policy statements supporting childhood vaccines.
And you think these organizations have the absolute most current information?
Yes, I believe their information is by far the most current. Diseases such as measles are beginning to reemerge in our country due to the lack of vaccinations. According to the CDC, the current increase in measles cases is being driven by unvaccinated people, primarily United States residents, who got measles in other countries and brought the virus back to the United States and spread to other communities where many people are not vaccinated.
So then this is happening in other countries, not here.
No, this is happening here in the United States. Are you familiar with Bill 327 that was introduced by Representative Schiff out of California? As a registered nurse, we see unvaccinated patients in the ER, which often require additional support and medical isolation.
Do you mean the one about... No, I don't recall or know of Representative Schiff.
The bill is titled Recognizing the Importance of Vaccinations and Immunizations in the United States.
Okay, this bill sounds familiar. Was there a similar bill in the past?
Yes, the previous bill died in 2015. This is similar in nature and introduces financial impact on unvaccinated people. According to the CDC, estimates that vaccinations will save nearly $295 billion in direct costs and $1.38 trillion in total societal costs in the United States. And even more, an estimated 43,000 adults and 300 children die annually from vaccine-preventable diseases or their complications in the United States, and the health and livelihood of young children, seniors, individuals with immunodeficiency disorders, and those who cannot be vaccinated is particularly compromised by communities with low vaccination rates.
Okay, well I hear you, but what about the autistic children?
The Institute of Medicine Vaccine Safety Review, as well as other publications, have published statements refuting all causal relationships between the vaccine and autism. I am only requesting that you look at Representative Schiff's bill and consider publicly changing your stance. Unfortunately, information was published in '98 that implicated vaccines as the cause of autism. The author came forward after this publication stating he was incorrect, but the damage was already done. Are you familiar with Ashland, Oregon?
I think I've heard about their anti-vaccine trend.
In March of 2016, 25.4% of the children in Ashland were unvaccinated. This is the second highest in the country behind Boulder, Colorado. I was a nurse in Ashland, Oregon, and saw extremely sick children, along with children suffering from cancer that were extremely vulnerable due to the lack of herd immunity in the Rogue Valley.
Well, I'm set in my ways. I believe that they are harmful, and I still don't believe your position. And why do you care what a representative from Massachusetts thinks anyway? You live in California. I live across the country from you.
I lived in Massachusetts for a few years and found the government proactive and progressive in nature. Also, with the last name of like Kennedy, people look to you for guidance and support. Support for the bill with a name like Kennedy behind it would help possibly get this passed. So I'm asking you for your specific help to ensure the passing of this Bill 327.
I'll read the bill, but I'm still unsure that I will be any support to you. I do understand that this bill is important, but also the parental rights are evenly as significant. I will do some additional research, but I can't promise you anything.
I appreciate your time and consideration. Please truly consider to reaching out to Representative Schiff to get more information.
Thank you. Have a good day.
Thank you.